Social Services, Christian Dubé, and the National Director of Public Health, Dr. Horatio Arruda. Mr. Premier. Thank you very much. Good evening, everyone. I told you yesterday that we were concerned about 5 regions about the pandemic situation, so I'm going to start with the good news. There aren't many. The Saguenay-Lac-Saint-Jean, we can see that the number of new cases is stabilizing, so we are going to continue monitoring the situation, but we are reassured for the time being, because things can change very quickly for the Saguenay-Lac-Saint-Jean region. However, we continue being very concerned, and we continue seeing today and yesterday an upward trend in the number of new cases in the other 4 regions. So the Outaouais, the National Capital, Chaudières-Appalaches, and the Lower St. Lawrence. So I am announcing that these 4 regions are, as of tomorrow, 8 p.m., go to red. That means, essentially, that unfortunately we're going to be forced to close down restaurants, and there will be a few other restrictions as well that weren't present in orange zones, but that are present in red zones. And I want to say right away that all the measures that we are announcing, we're going to be financially helping the businesses and others who are going to be forced to close down. However, where we truly have a lot of concerns, because it continues deteriorating, is Quebec City, Levis and Gatineau. We can see yesterday and today the number of cases continues increasing almost exponentially. And of course, it hasn't yet affected the hospitalizations, but we expect that over the next few days and weeks that there will be a very significant increase in the hospitalizations in Quebec City, Levis and Gatineau. That is why I'm announcing that, taking into account that the situation is critical and we have to act quickly before there is too great an impact on hospitalizations, that as of tomorrow at 8 p.m. in Quebec City, Levis and Gatineau, we are going to put these sub-regions on pause for a period of about 10 days, so until Monday, 12th of April. That means concretely that we're going to be closing down, as we had done at the beginning of January, non-essential businesses, schools, cinemas, theaters, museums, hairdressing salons, gyms, and others. Of course, as I was saying, we're going to be setting back up the financial help programs, and we're going to be limiting, for Quebec City, Levis and Gatineau, the places of worship to 25 people max. So, those are the first measures. On top of it, in those 3 cities still, we are going to set the curfew back up at 8 p.m. That means that essential businesses like grocery stores are going to have to close at 7:30 p.m. So generally speaking, what we're saying is that the situation is critical. It is deteriorating in those 3 cities, and people essentially have to remain at home, except if they absolutely have to go work. So we call these special emergency measures, and it will be applicable, just to be, very specific. You have it in the communiqué that we sent up, in the urban community of Quebec City, that includes Lévis, as well as in the city of Gatineau and the Les Collines regional area in the Outaouais. So of course, there's no need for me to say that what hurts me the most in that are the schools. However, taking into account the Easter holiday, most schools were going to be closed Friday and Monday, and even there is another civic holiday in other places, for example, in Quebec City on Tuesday. So that means that we'll be closing down the schools in all about 3 or 4 days. But, and it's important to say to the children and the parents, there will be remote teaching. So as we had done over the holiday period. And the daycare school services, so after school, they will be open, but only for priority workers. But regular daycare services are going to remain open, but I would ask all parents who are able to keep their children at home to do so. We really have to, over the next 10 days, really work really hard in those 3 cities that I mentioned. Of course, the situation is evolving quickly, and we cannot exclude that over the next few days there may be other areas that will be added. I have to admit that when we started seeing the increase over the weekend in the 5 regions that I was talking to you about yesterday, those were not the regions where we're expecting to see an increase. We're expecting to see that in Laval, in Montreal, where we had seen some in the preceding waves. But now it happens that it is Quebec City, Levis and Gatineau in particular, and it's coming really quickly, and that is why everybody has to be prudent in Quebec. We don't have the same strain as before. We have a new variant. The impact is quicker. Before we could say, okay, let's take a day or 2 to set up measures and see how the situation moves. But now we have to truly act very quickly. And it could explode in any region in Quebec. At some point today, we are looking at regions where things look pretty calm, but with the variant, we never know, and it can explode, and we are following that very closely, and we're making sure to be flexible and agile. That is, that we're giving ourselves the responsibility of being ready to act quickly. As we often say, and I have been saying it since the beginning of the pandemic, better is the enemy of good. So it's nice to accumulate data, but we get new data every hour, and at some point we have to make a decision, and it's better to make a decision that is not perfect more quickly rather than waiting too long and seeing the situation deteriorate. So I will end by saying to all Quebecers, let's remind ourselves of the guidelines. They're simple, but I understand that after a year, some people are tired of them. We have to keep a 2-meter distance between other people. We have to wear a mask. And no private gatherings. And I'm repeating that because, and I said it yesterday, yes, there can be contagion in theater rooms, in restaurants, but where we have the most concern is in people's homes. And we're very conscious of the fact that it's Easter weekend, so there's a long weekend. Nobody should be organizing parties or gatherings at home. This year, we have to celebrate Easter at home. We cannot get together in the present situation, and I am saying that for every region in Quebec. So it's important. The alarm is sounding. You can't make any little exceptions. We have to follow the rules to the letter. It is the only way to avoid an explosion of cases, as we can see in Quebec City, in Lévis, and in Gatineau. So we know that, unlike a year ago, we know that we're going to get through it with the vaccination. We can see the light at the end of the tunnel. We are vaccinating, and things are going very well up until now. And of course, vaccination, that is what our freedom will be. So we can see that it's coming. In the meantime, however, we have to make efforts. And I would ask all Quebecers to show solidarity. Let's think about our children, for example. We want for our children to be able to go to school for as many days as possible, and let's think about our nurses and all of the staff in hospitals who are at the front lines and have been for a year. So let's show solidarity. Everybody, be prudent. Be very, very prudent. Thank you.
Good evening, everyone. As I said yesterday, the situation is worrying in 5 regions. It's getting better in Saguenay-Lac-Saint-Jean, but it's still very worrying in 4 regions: Outaouais, Capitale Nationale, Chaudières-Appalaches, and Saint-Laurent. I'm announcing that these 4 regions will turn red tomorrow at 8 p.m. But the situation is even more serious in Quebec, Lévis, and Gatineau. This means that in the coming days, hospitalization will increase. We must act quickly. This is why I'm announcing that Quebec, Lévis, and Gatineau will be on pause for 10 days until April 12. This means that non-essential businesses, schools, theaters, museums, hairdressers, gyms, among others, will close tomorrow starting at 8 p.m. We'll also restart financial help programs. And for places of worship, we'll only allow a maximum of 25 people, and the curfew will now be at 8 p.m. again. I'm talking about Quebec, Lévis, and Gatineau, and I'm asking people in these towns to stay at home. The special emergency measures will apply in the Quebec area, including Lévis, and in the city of Gatineau, as well as the MRC Les Collines. We'll keep school childcare open for priority workers only, and for regular childcare, we ask parents who can to keep their children at home. So everywhere in Quebec, we have to be more careful. With the variant, we can see an explosion of cases within a few days. We're ready to act quickly and strongly if the situation worsens in other regions. We all know how to avoid contagion. We need to stay at 2 meters, wear the mask, and avoid gatherings in homes. So I ask you to be very careful in the coming days. I ask you to show solidarity. Thank you.
Merci. Nous allons passer à la période
Thank you.
des
We're now
questions.
going to go
D'abord
to the
en
question
français,
period,
ensuite
first in French and then followed by an English period question. Hello, gentlemen. Mr. Legault, you've said nothing about Montreal. I understand that the situation reassures you. You had said it yesterday already. But Montreal, how many meters away are we from the precipice that could bring Montreal towards restrictions such as what we can see in Quebec City and Gatineau? Well, as you can see, in the past month, Montreal is between 300 and 350 cases per day. So the number of cases is not doubling, but we can't take anything for granted. It could explode in Montreal tomorrow or in 2 days or next week. So we can't exclude anything. But for the time being, the situation is relatively stable in Montreal. You said earlier on it is better to make an imperfect decision too quickly. Why didn't you make that decision last Friday, for example, making sure to push back the reopening of schools, which it seems it does have an impact today? Well, first of all, we have to look at the consequences of closing down the schools on the learning of the children and their mental health. Secondly, I have to admit to you that over the weekend we were a little bit, all of us, surprised to see that things were not exploding in Montreal and Laval, but it was rather in other regions where things were going on. There were 5 regions of concern. We monitored them for a few days. There is not yet any explosion in the number of hospitalizations, but we don't want to wait for the situation to be like what it is in France or like what it was in Ontario, and that we are forced to make measures that are even greater. We're going regionally, and the situation is really different from one region to another for the time being. So is it the schools that are closed until the 12th of April in Gatineau, Quebec City, Lévis, and is what we call these new zones, these black zones? No, I saw that on Twitter. No, it's not a new zone. These are temporary measures for around 10 days, and it concerns all businesses as well, all non-essential businesses. We're going back to the measures that we had in January. But it's not just schools, and we're also asking, mandatory work from home. So all the measures that we had in January. But is that realistic to think that we'll have gone through it in this period of time? Going through it doesn't mean that the variants are going to disappear and that the cases are going to decrease drastically. We'll just have a better control, because 10 days of decrease, it has to be understood that there's been, a slackening, but what we are observing here, it means that people are not following the measures. People are tired, they're sick and tired of it, so they're not doing what they should. And we have all sorts of stories of people who have interpreted things differently, or they just didn't want to anymore. So bringing things to a pause. It's not a new zone color at all. We're just putting things on pause. We're going to significantly decrease the contacts, and that will have an effect on transmission. Is it going to fix the problem entirely? The answer is no. But what we have to do is to lower that acceleration in order to not lose control, and that number of cases, while it increases, means that there's more people in hospital and in intensive care. Mr. Legault, you said that right now it's difficult to ask for more, that people need a bit of breathing room. How do you think people are going to react? Do you think that people are going to follow? Do you think it's going to have to go through coercion and fines and surveillance? I think that people, the vast majority of people, let's take Quebec City, people understand what the situation is. They're following the numbers every day. They have seen, 50 cases per day for many weeks, and all of a sudden we are at 200 cases per day. So people can see that there is a situation that is different, and we have to take precautions. There's always, there's a minority that is going to continue criticizing the measures, but I think that when we go from 50 to 200 cases per day, well, we are going to have an impact on hospitalizations, and people, if they are ill, they want to continue being cared for. If the beds are all occupied by COVID patients, they won't be able to be taken care of. What would happen? Because you said that you had projections and that at some point, the alarm started sounding. What would happen according to the projections that you have in the regions that are being targeted, for example, Quebec City? Can you give us a demonstration of the effect that it would have if we were not to do what you're doing? What will we be going toward? Well, as Dr. Ruda often says, it depends on how well people follow the measures. I mean, are people going to respect, the fact that it's forbidden to go visit other people in other homes? What percentage of people are going to do that? That is where things get difficult. So that is why it's also, in adding or bringing back the measure of curfews to 8 o'clock, if ever there are people who don't respect the rules, well, they're going to respect them. They're going to not respect the rules for less time because they had to be home. We were very transparent with the studies of the INES and the INSPQ, and I'd like to remind you that the last study that had been presented by Professor Brisson from Laval University, I think that it's dated of the 18th or 19th of March, so it looks like it was, a long time ago, but in that study, and I'd like to come back to the point of the Premier, if we have a strong adhesion or an average or a low, which are very clearly explained in the study, you can see that in low adhesion we go back to the situation of after Christmas, the beginning of January, almost 2,000 cases per day, and that's where we don't want to go. So let's be very clear, we knew that that was a possible scenario, but that is why we are acting before that happens. Because now we see that there seems to be that kind of progression. As it is simulated in the low adhesion, we don't want to go there. That is why we're acting today. And I suggest to you, for those who are interested in that, go back to the INSPQ website, go and have a look at that analysis that was presented, and we can see quite well, the real points that we've seen for the past 3 or 4 days, they seem to be in the situation of the case that we didn't want to go to, but that seems to be taking place in Quebec City and in Gatineau. There are business owners who are not going to be happy, restaurant owners, for example, because for them things get complicated because they have to manage food stocks and, they order things and then they're going to be closed for 2 weeks and all that. We understand their situation. We can see that with the gyms, for example, in Quebec City, we have a very good example of what it can lead to. Do you have any data that show in those sectors, for example, in restaurants, in gyms, we saw it in Quebec City, but elsewhere in general or in other workplaces, do you have any recent data, for example, in restaurants that show that there have been outbreaks following people going to restaurants for the past couple weeks? You were looking at me, so I guess you were talking to me. The outbreaks that were associated to restaurants, we've heard anecdotes, but not necessarily because the restaurant owners were not doing the work. I would say that it's the, socialization effect that is found in There are situations we're told where there was like speed dating tables. There were things that were inadequate. And situations where, and that's where the problem is very often, and that is where we end up penalizing everybody for things that happen only in certain places. That is very unfortunate. And more we're trying to have an approach where we act where there are clear lacks to following the guidelines. But it has to do with increasing socialization and the number of contacts. And when we close down, of course, there are perverse effect, unfortunately, of closing them down. But it decreases contacts. And I mean, it's the case in restaurants, and it's a case in gyms. And when I say that, I'm not saying that all restaurants had this happen. Very often, it's not necessarily restaurant owners. It's the clientele before, after. That's what we mean.
Alain Laforêt, TVA Nouvelle.
Bonjour à vous trois. Monsieur le Premier ministre, en fin de semaine, le Collège des
Mr. Premier, over the weekend, the College of Physicians sounded the alarm saying, we cannot go where we're going. That is, a partial deconfinement. What is the principle of precaution that you are applying right now for the metropolis, since you are saying we don't know what's going to happen over the next few days? Are we to, do we have to wait for things to fire back up before we move? No. What we have to do is to look at the cases, because it's a precursor of what will happen in hospitalizations. But when I look at the comments that we had over the weekend from the College of Physicians and the opposition, there wasn't any specification. Was it in Montreal that they were asking us to move? Where were they asking us to move? And now we can see. No, but look, we went in the Mauricie, Centre du Québec, and the Eastern Townships from orange at the same time as in Quebec City. Everything is going well for the time being in the Eastern Townships and Mauricie, but it's not going well in Quebec City. So when they were asking us to take a step back, did they mean on everything? I think that we have to have facts, and that's what we're doing. We looked at things regionally, the evolution of cases, and we can see that in amongst other places, in Quebec City, there is an exponential increase now. It was in the news a lot today, and people talked about it a lot, and you've defended him many times. Your minister for the economy, is he something that is a ball and chain for the government right now? No, he is very good for us. And I took we're showing the picture of business people in Paris, very honestly, business people that I didn't know and that I still don't know. But, pictures on traveling, I take lots of pictures. There's a lot of business people that may want to get photographed with me. But there's nothing new that was added to what is going on except a picture. Just to go back on that question of Alain, just to clear, your cabinet indicated to the newspaper that you were not aware that people from White Star, Mr. Fitzgibbon was an investor at the time of the picture, and Mr. Fitzgibbon let it be understood this morning that your cabinet was aware. Could you clear that up? At what moment were you informed that Mr. Fitzgibbon had money in White Star? Well, that, we have somebody who went over all of his investments. I don't know this off by heart. I know that he had investments in 13 companies. He sold 9. We have a couple left. I think that's one of them. But no, at the time I didn't know that there was an investment in the company with the group that I was photographed with. Mr. Dubé, I'd like to clarify what you said earlier on. You said that in the 3 cities, Quebec City, Levis and Gatineau, if we base ourselves with the projections of the INSPQ from mid-March, we were in the low adhesion zone. So in those 3 cities, we end up in the present situation because the public is not following the guidelines. Well, that is one of the factors. Because what has to be understood is, first of all, when you look, and I'm sure that you've done it, but we have always shown Montreal and the other regions of Quebec. We have never had the necessary granularity to do Quebec or Chaudières-Appalaches because it's very difficult to do simulations for regions where there's fewer cases. That's the first thing. But when you follow the progressions of these three simulations, so, poor, medium, and high adherence, it's obvious that right now, the pattern, what is happening in our regions is following the simulation of poor adherence. Now, there's other factors as well that are taken into account in the study, but that's why today it's not so much as saying, these people didn't follow, these others did. We are just seeing that the cases are going up very sharply right now. And as I said, a week ago we're at 50 cases in Quebec City, then we went up to 100, and then 100 and some, and tomorrow it's going to be over 250. So we cannot not act. But once again, we don't have any effect on hospitalizations or intensive care either. So if we can have a drastic measure like the one that we're announcing today, we'll be acting before seeing an impact on the hospitalizations in a very clear way. And that is why we're acting quickly. Dr. Arruda, only 48 hours ago we spoke, and there was no question to tighten things up again. You said that it was better to wait, that we could tolerate at least 2,000 cases as long as the hospitalizations were not going to increase. And you said it was better to wait and that we should not panic. What happened? Well, as I said, we are following the situation from 1 hour to the next. And look, in Montreal, we're still saying that we're waiting. Are we going to change our minds in 3 days? It's possible. And the increase in the variants in Quebec City, we saw that there was an upward trend, but we were not in such an accelerated increase as we can see now. So we really are in a new phenomenon. The expression of a variant probably associated to an increase, I would say, of contacts between different people, and so we are intervening. And I'm going to say right away, and I've said it since the beginning. What I'm saying now could change tomorrow. We knew that there were going to be variants, and you can see that in the Saguenay-Lac-Saint-Jean there were variants. It went back up, and now it's starting to decrease. So we have to see really where we're at. If I want to make an image, there are wounds that we can treat with an antibiotic sometimes, and we observe it. But at some point, you have to amputate because it's going to degenerate too much. And that's where we're at right now in terms of very rapid increase in Quebec City. And when it goes up in that way, we look because it could start going down, but now it's like it's accelerating. So we have to intervene. Just so I understand, Mr. Premier, is that a recommendation that was given to you by Dr. Arruda, or did you insist to say, no, we have to do that now? We can't wait. It's a recommendation that came from public health. But we always have ongoing discussions. There are many ways of stopping an increase in the number of cases, in cases of contagion. And we've talked about different measures, and it is a recommendations of public health, what we are presenting to you tonight. You talked about an imperfect decision that has to be taken quickly. I feel perhaps, what is going to happen in Chaudières-Appalaches or in Beauce over the next few days? What is going to be happening in Rivière-du-Loup over the next few days? What's going to happen in the Saguenay-Lac-Saint-Jean in the next few days? What is going to happen in Montreal? At some point, we have to start taking care of the regions where we know that things are increasing too quickly, and tomorrow and the next day and next week we'll adjust ourselves. But we cannot wait to get more data. We get new data every minute. So things are going to continue evolving, and probably over the next few days we'll adjust the measures depending on the regions. Mr. Premier and Mr. Arruda, you've always said that you wanted to avoid the yo-yo effect, but now we really are in some of those regions exactly in that yo-yo effect. How do you justify terrified. Well, listen, we're no different from anywhere else. Look at what Mr. Macron, the French president, announced. Look at what Ontario is going to be announcing over the next few days. Everybody is in this situation where we are adjusting ourselves. And listen, if we had not wanted to take any risk, we would have closed more in Montreal, and we would have made a mistake, because for the time being, we've been able to give a bit of breathing room to the people in the Montreal area and the 450 area code region. But are we going to have to act next week in the Greater Montreal area? Perhaps. What we're doing right now is we haven't played yo-yo. The changes of color from one zone to another have taken time. We didn't go to just red, and then we go to orange, and then red, and then orange. No, what we're adding right now is an emergency measure to intervene in a place where something is going on. It's like we have to put the population in intensive care right now, otherwise we're going to lose them. That's the difference. So when you're talking about yo-yo, it's just to continue to change color, open and close, open and close, open and close, but now we have to act with emergency measures. That is what we're doing. It's for a short period of time, 10 days. Dr. Arruda, you also said that public health has to take into account the number of determining factors, that it was important when we announced, slackening measures for public mental health. But don't you think that what you're announcing as restrictions, it's going to affect people's morals? A lot of people? Well, yes. And we're conscious of that. But it's a 10-day period. I know that 10 days can seem like a lot, but we have no choice. Otherwise, it's just going to overwhelm the healthcare system. And when people make associations between slackening and what is happening, we are one of the provinces that has maintained, tightening of measures for a long time. We don't have the right to get together in people's homes. In Ontario, they allowed people getting together. So we haven't, slackened that much. And we're not accusing anybody, but we were just noting that the adherence to the measures has probably been poor. And in some places, like places that weren't necessarily affected, when it started to go up again, it started to go up in other regions. And what's happening in the National Capital Area is the sum of all those different elements.
Olivier Bossé, Le Soleil.
Bonjour, messieurs. Qu'est-ce qui s'est passé la différence avec hier pour Québec en particulier?
What's different from yesterday for Quebec City in particular? Are we here because of a gym? No, I think that we had to look more at things more broadly. Of course, the case where the gym is a very unfortunate case because we're at over 60 cases now. Of course, when we're talking about 200 cases in one day, if there are 60 that aren't all in the same day, but I mean, it's still very significant. But I'd like to come back to something broader. It is the speed at which this variant is moving. We were talking on Sunday, we were going, okay, it went from 50 to 100, but now if the 100 goes to 150, we're going to turn on the red lights, which is what the Premier did yesterday. He turned on the red light. And, now we're telling you that we have those cases live. We're so well connected to the network right now that we know live how many cases we have. And we were able to see that in Quebec City, it really was exponential. So yes, the gym was a factor, but I think that it is an indicator of the adherence to the measures. And I'd like to say, if there is one thing that we have to remain agile. If there's a word we should keep in mind over the next few weeks, when you talk to me about Montreal, together with Dr. Arruda, we speak with Dr. Trépanier and Dr. Drouin, 2 or 3 weeks per week for Montreal and Laval. We remain very close. I already know the cases that we're going to be having in Montreal tomorrow. If it's stable, the Premier is right to say, that we're going to keep an eye on that every day. And if we have to act in Montreal, we're going to do the same thing. Mr. Legault, do you have any fear of experiencing what happened after the holidays at the beginning of January, even though it was tighter, the measures? Well, we're acting more quickly because when we look at the hospitalizations, they're still under control. But we are acting following the increase of cases, telling ourselves there will most probably be an increase of hospitalizations next week. So we are acting more quickly, and we're acting in a more targeted fashion. And we're going to be continuing, if necessary, to act in other regions over the next few days. Dr. Arruda, just to be clear, the rules were adequate in Quebec City, Lévis, Gatineau, and people were not respecting them sufficiently. Not enough people were respecting them. Well, when we look at the rules that we set up, if people respect the 2-meter distance, if people don't get together, etc., it's a virus that feeds off of contacts. So for that virus to have increased so much, it means that there were conditions of transmission. The measures that we set up, in my opinion, allowed, while accepting some transmission, we've said it before, having children in school, we know that there will be a certain level of transmission. But now it's in all of society, and we can see it through the example of that gym. Well, something happened in that gym for contagion to take place. And so that's what it is. It's a question of adherence. To what extent is it strong? And to what extent do people respect the measurements? And the 2 meters is difficult, and now people are like less than 2 meters with a mask, less than 2 meters without a mask. That's what we realize. So that's what's going on. Could we think that you're putting it a bit more because you know that people are not going to respect all of the rules? And Mr. Premier, yesterday you said that you were proud once again of maintaining the schools open, that 96% of students were still there, that for you it was a great source of pride, and 24 hours later you are closing them down for about 10 days in the 3 cities mentioned. Why go all the way there? Couldn't we do something different? Well, of course, if we close the non-essential businesses and we're changing the curfew to 8 p.m. so that people don't go in other people's homes so much, but we believe that it is necessary to go to that extent. And we also believe that the timing is good, because out of the 10 and 11 days that are coming, well, there are 2 weekends. There's the Easter Friday and Monday, and in Quebec City on Tuesday there was a holiday. So the children will have lost 3 days and will have saved 11 days. And during those 11 days, my friend Christian, so can you answer the other part? Are you putting more in because you think people are not going to respect? No, we are putting in more measures because what we want to do is to decrease the contacts. This is a virus that feeds off of contacts. A new variant is very transmissible, and being very transmissible, the more we have contacts, the more we can infect people. So we're putting more for that. Thank you. What about the variant for transmissions? It can go up to 1.4 or 1.5. So it doubles? Yes, it can double, yes. Almost, not far. It can be 1.6. It depends on the measures that are set up. But yes, it can double, almost double in 3 days. In the analysis that I was talking about of Dr. Brisson a few minutes ago, in one of the charts we can see the difference between, I'll call, the old virus and the new virus, and you'll see the difference in the R factor. There's a very large difference. I'm sorry, gentlemen, whether I'm repeating things. I was on air, but can we go back to the delay in the intervention of the inspectors at the gym this morning? Why did it take such a long time? When you reside in the city of Quebec, they were already talking about it last week, that there was no measures over there, that 10% of people were wearing a mask. Where were the inspectors during that time? I have to admit to you that I did not make any detailed analysis of that element, so perhaps you would have to ask that question to the people in Quebec City. I think that there were interventions that were made, but honestly, I have to say that I'm not able to tell you at what date, such and such a thing happened. I could get the information, but it's more in Quebec City that they'll be able to give it to you. Mr. Dubé, could we review the vaccination rate per age group? Because right now it's especially the young people, visibly, that are moving around. So could there be, per region especially, a change in the rhythm of vaccination? Well, first, I'll give you the usual answer. We have a cruising rhythm and priorities that is fixed by public health, and we can't not follow it. We have a committee right now, an immunization committee, that is going to prioritize certain categories. However, when we can adjust ourselves, where we can adjust ourselves when we see it, especially when we saw what was going on, is we asked to accelerate the vaccination in certain regions. That's why in the past few days we have asked in Montreal, we said, okay, well, listen, make a sacrifice, the same sacrifice that we asked for other regions a few weeks ago. Well, do it for Montreal. So I talked about it yesterday. So yes, we are adjusting ourselves, but we're not yet into age categories. And I want to be careful as well when we say, and I just want to make sure that we understand, when we say younger people, of course, people who are 65 and over, that we have vaccinated quite a bit already, they're not the ones that are going to the hospital. They are not, it's also not people who are 16. We're talking here about people who are younger than the eldest. So we have to be careful that it really is that age category where the percentage has a much higher percentage of presence in hospitals, and that is what concerns us. But that is why the Premier is right. What we're asking people is the effort of the next few weeks is to give us the time to vaccinate. We had a few problems with AstraZeneca. We're going to find solutions, but we're still able to vaccinate. And you'll see tomorrow, Friday, in my numbers, I still have 50,000 vaccinations per day, Thursday and next Friday. So during that time, we're vaccinating, and we'll be able to vaccinate in those regions. So that is what we need. We need time to vaccinate our people.
Just a little clarification on Lévis, Quebec City, and Gatineau. There are very targeted emergency measures which you're announcing. Is there any provision, because they're smaller areas, any provision to stop people from going in or out of those areas? Is it what you have said in the past, travel between these areas is not recommended? If you could clarify.
Well, maybe if there is one thing that we have to discuss with Gatineau is the link with Ontario, because especially with Ottawa, Elmer, and Gatineau, we were talking. My cabinet was talking to the mayor of Gatineau. We will find a way to make sure that there is less communication. I think the good news is we're talking also to the province of Ontario so that we can make some arrangements. So I'm not giving you the full answer, but we are in discussion because we announced to them the measure that we took this afternoon. So they are aware of what we do, and we will see. Now, with the other region, I don't think we have any specific for now.
But I think it's highly not recommended to go to those zones because there is active transmission. If you go, you must make sure you have distanciation, you have your mask, and and you must understand that stores are going to be closed, restaurants are going to be closed. So I think if you have a professional reason or an essential reason, I would say I highly recommend to not go to those zones.
And my second question, Montreal is not affected by these new restrictions. Does that mean that we're getting closer to the light at the end of the tunnel in Montreal, or do we not know?
We are all going to get closer of the end of the tunnel, but I cannot say that Montreal is necessarily closer. The only thing is that we have seen there is a slow slope. There is no this active slope. As I'm telling you, I don't know if this weekend is going to go up and everything, and it's always possible, as anywhere in Quebec. And it's very difficult because I cannot predict. But at the same time, at this level, we cannot apply the same thing that we are applying in Quebec or Outaouais. And I think it's very important to understand. And it's not a new color. It's an emergency approach in a specific place for 10 days.
Cathy Sonnet, CBC.
Good evening. I would like to know, Premier Legault, how mad are you at the owner of the Mega Fitness Gym and like the clients? Because now the clients are basically responsible for 8 outbreaks in their own work environment. So what would you like to tell them today?
But first, like Christian said, it's not the only reason why we are in trouble in Quebec City. Many people didn't respect rules for the last few weeks. It's clear that we had the same measures in Quebec than in Trois-Rivières or in Sherbrooke, and the results is very different. So it means that many people didn't respect the rules, including the owner of this gym. So of course, I'm not happy to see that some people don't follow the rules. I think it's important. It's a question of solidarity. You have to think about those kids that won't be able next week to go to school. You have to think about nurses that are working hard since 1 year. So I think it's not against or between him and me. It's between him and other citizens suffering from the bad decisions he took.
Okay.
And I just want to add that it demonstrates that this new variant is a very vicious virus because it spreads very fast. It had attacked a lot of people, so it's why we must be careful with this variant.
And my other question is about the vast majority of people following the rules. As we speak, they are families, friends, having discussions in Lévis, Quebec City, and also in the Outaouais, saying, we are following the rules, but now we are put in the same category of the slackers. What kind of backlash are you expecting from this type of emotions this evening?
I think that the facts are there. And I think that the vast majority of people in Quebec City, they want to make sure that there will be beds available in hospitals if they are sick. So they understand. I think that the majority of people understand why we take those decisions. But of course, I guess they can see that some other citizens are not, don't show solidarity as much as they should.
Can I just add something on this, Jim, and to look forward for the next weekend? This is Easter. In any religion, it's called a different name. And this weekend, it can happen like this in Montreal or in any other region. Please look at the way this variant has been so fast in that gym that if it happened in Montreal or in Sherbrooke over the weekend, think about that before going to any religious, any event, anything that can happen. Because you can see, let's use this example in the gym that happened 2 days ago, and let's make sure it doesn't happen this weekend during that long holiday.
Raquel Fletcher, Global.
Good afternoon.
Good night.
Good evening. Sorry. Good evening. Yesterday, when we were all here for your press conference, my colleagues and I asked you things like, we see an impending doom in other jurisdictions, in other countries. Why are we different here in Quebec? What do you say to the criticism from the Collège des Médecins that we reopened too quickly? And can you really get it under control? That was yesterday. We asked you those questions, and you reassured us that hospitals had the capacity to handle the however many cases we saw here in Quebec City. So did public health drop the ball somewhere? How come you could not foresee that we would have to completely close 3 major cities in Quebec just yesterday?
But first, I want to say, because I'm looking every night at what's happening in other states and countries in the world. And look, for example, what happened in France. Since weeks, they had 30,000 new cases a day for many days. And it's yesterday that the president said, okay, we'll put in place new measures to close schools. So we acted a lot faster than anybody else. Look at what's happening in Michigan, in Massachusetts, in New York, even in Toronto. We're acting fast. We already had, before today, the toughest measures. So right now, we react very fast, and we are doing it in regions where we didn't expect that it would be that worse. We didn't expect that it would be worse in Lévis than in Montreal or Laval. So as soon as we see an increase, an important increase in the number of cases, we don't wait to see an increase in hospitalization. We take decisions. So we're reacting fast. Last week, we didn't have those increases in those regions or cities.
You're not concerned then that there is a breakdown somewhere in the system in where you're getting your advice from your experts, that they're not seeing things in time?
I want to remember you that so far, you can talk about the first wave, but so far we're doing a lot better than the average.
Do you know the expression, give an inch, take a mile?
Yeah.
Yeah. Do you think that is happening to some, or some Quebecers are reacting that way, that you said, okay, we had this 8 p.m. curfew, we're going to lift it to 9:30, we're going to give you a little bit of loosening up here, and then they went too far with that and started having parties? Is that what you're insinuating?
Yeah. A part of it, yes. I think that when we decided to change the curfew from 8 p.m. to 9:30, don't remember at the time that we changed the hour, we advanced for an hour. So people said, hey, we should have an additional hour to work outside. But what happened? Some people, they think that because the curfew is at 9:30, that they can go and see other people in homes for an additional an hour and a half. It's clear, and even the INSPQ, they said, young people, 20, 30 years old, 50% of them did it. So, of course, and on top of that, people are fed up after a year. So I can understand, but today we're saying it's a wake-up call. The situation is very serious in Quebec City, Lévis, and Gatineau. So please, it's not fun, and it's really time to be careful, very careful.
Raquel a pu poser 3 questions parce qu'elle en a posé seulement une hier, faute de temps.
Okay.
C'est juste pour,
She was able to ask 3 questions, Rachel, today, because yesterday she only had the time for 1, so we're going to continue. Okay, so we're making sure that Kathy's not going to be angry. Can we continue?
Are you not worried that it might also happen in the Montreal area, where it's a red zone, but gyms are reopening, spas are reopening, schools too? Is this a good idea to reopen all this?
But I think that so far we did it and the results are good, but it may change very fast. The variant is showing us results, bad results, very fast. So I don't know what we'll have to do in Montreal in the next few days, but so far it's under control, so far.
And Pfizer says its COVID vaccine is 100% effective in protecting kids aged 12 to 15. What kind of impact it can have to if that age group would get the vaccine?
First of all, our strategy actually is to protect people who can get sick and get to hospitals and have complications. But as soon as we will have covered higher age, that could be part of a strategy to diminish the transmission of the virus for the ones who have not been vaccinated. But actually, we will not change our approach for the moment. But if we had obtained a high coverage in Quebec, there's going to be possibly some school programs this fall or beginning of the winter.
And Mr. Legault, just quickly, what message do you have for business owners who have to go back in red zone, have to shut down again, like restaurant owners who had difficulty to get workers, and now they have to shut down again, lose fresh food. What message do you have to them?
I think that the best thing that can happen for the economy and for businesses is that we get rid of this virus. So as soon as we'll get rid of the virus, it'll be better for all business people in Quebec. So that's why it's the top priority to take decision that will give us this possibility. And in the meantime, we'll re-put in place the programs to help them paying for their rent and covering their expenses. So, and I guess all business people in the same regions are treated the same way.
Alors maintenant, des questions posées, transmises par des journalistes qui ne sont pas membres de la tribune de la presse du Parlement de Québec.
Journalists who are not present. What will happen in Charlevoix and Portneuf? Yesterday on Tuesday, the situation was said to be under control. Are these two sectors to go into red zone as well? Charlevoix and Portneuf are going into red zone, so essentially that means that in fact restaurants have to close down. However, all the measures concerning the curfew will stay at 9:30 p.m. All the measures concerning businesses, hairdressing salons remains as it was before. And why are we putting them in red zones? Well, because there is a healthcare system and hospital system and specialization system, which is for the entire region. Public health in the Abitibi-Témiscamingue is describing the situation today as being fragile because of the predominance of the South African variant. Are you going to accentuate sending vaccines in the Abitibi-Témiscamingue like the other regions announced yesterday? Well, we cannot compare the situation. Yesterday we had 7 new cases in the Abitibi-Témiscamingue region, in the entire region. So we can't compare the regions, to Quebec City or Gatineau. So for the time being, I don't think that we can justify sending more than their proportion of their population. What will be the follow-up plan by the government about the educators and teachers and students who will have worn the masks judged to be toxic by Santé Canada? Well, right now there was a preventive withdrawal that was made. I asked our teams to see whether there were any longer-term effects or advice to give to people who were exposed. Right now it's not the case. That's what we're told. But we will do a follow-up depending on the evaluation that will be given to us. The risk analysis made by Health Canada was for long-term exposure, so we'll have to look at that more closely. This puts an end to the press conference. Good evening to everyone.